Hi, everyone. Good afternoon. How are you today? Welcome to today's IECHI Quarterly Health Education Forum, Youth Education and Mental Health, Meeting the Challenge. I'm Alice Nelsner, and I'm CEO of the San Bernardino County Medical Society and also the chair of the IECHI, or the Inland Empire Community Health Initiative, a coalition whose mission is to ensure that all families and residents have access to affordable, quality, and culturally sensitive health care in the Inland Empire, including Riverside and San Bernardino counties. And we encourage you to look up our website at iechi.org and, of course, our Facebook page, IECHI, and Instagram pages as well, where we will post information about events and upcoming projects, as well as recaps from our past projects. Just a couple of quick notes. If you'd be so kind as to keep yourselves on mute. If you're not speaking, that would be awesome. And feel free to go ahead and enter questions in the chat feature as the presenters are speaking, and we will get to those at the conclusion of the presentations. And if you prefer, you can raise your hand at the end and we'll get to your question that way as well. And we always appreciate being interactive. All right. I'd like to begin by introducing our keynote presenter. David Siegler, MD, is Arrowhead Regional Medical Center's Behavioral Health Chairman, as well as Vituity Medical Director. He received his Doctor of Medicine degree from the David Geffen School of Medicine at UCLA in 2011. He completed the UCLA San Fernando Valley Psychiatry residency in 2015, where he also served as the Chief Resident of Inpatient Psychiatry. Dr. Siegler joined the ARMC team in 2019 as Vice Chair of Psychiatry, and he soon became the Interim Chair for Psychiatry before accepting his current role in April 2021. As Chairman, Dr. Siegler manages the day-to-day operations of his department, oversees the psychiatry residency, and develops new programs that can benefit the hospital and patients. He's also currently an assistant professor at the California University of Science and Medicine, CUSM, Medical School, adjacent to the ARMC campus and a good partner of ours. Dr. Siegler has published and presented on many psychiatry topics, and he has won various awards for his academic and professional pursuits. He's an ABPN board certified in psychiatry, is licensed by the Medical Board of California, and is a member of numerous professional psychiatry organizations. And outside of work, Dr. Siegler enjoys baking, cycling, and restoring cars. Welcome, Dr. Siegler. We'll turn it over to you.
I have to say that was probably one of the best, most detailed introductions I've ever gotten. Thank you very much.
Well, you're deserving. So,
oh, you're gonna make me blush. Thank you very much for having me today. In my role, I tend to see our youth in the sickest of the sick situations and probably the most difficult situations because, unfortunately, inpatient adolescent beds are quite rare. In fact, over at Arrowhead, we don't have any at the moment. So what frequently happens when someone is in crisis and they get brought to us is they actually get admitted to the pediatric service and are seen by our consultation liaison psychiatrist, which good, bad, or indifferent, most of our psychiatrists are actually not board certified in child and adolescent psychiatry, but rather just either general psychiatry or consultation psychiatry. Now, granted, in our training, we all have plenty of experience seeing child and adolescent. We just don't have that dedicated 2-year fellowship in child and adolescent psychiatry that, of course, tunes you to that specific area of treatment and the issues that are, quite frequent because just like in a regular pediatrics case, you don't have just one patient. You usually have at least 2, if not more, because you have to work with the family as well. This is very important because a lot of times when I see a child come in, I've got 2 or 3 other people in tow, sometimes siblings, sometimes mom and dad, sometimes foster mom, sometimes an aunt or an uncle or a caring grandmother that has taken the child into their home. And it leads to a lot of interesting issues. Of course, the first thing that we want to look at is, do we need to make a mandated report? Do we need to start looking for signs of trauma or abuse that's happening in the home? And we will also want to understand what led to the patient coming in the first place. A lot of times when I see a patient in Arrowhead, they're in handcuffs. They get brought in literally in handcuffs. And a lot of times they're not explained what's going on and what's going to happen to them. It's scary. It's very scary. And you get people who come in who are agitated because they're simply in handcuffs and they're scared and no one has told them what's going to happen to them or what's the next step for them. And more often than not, my job, at least at first, is to see what basic needs that patient needs. Because a lot of times when a patient is coming in from the community, depending on the time of day, they could have been either restrained on a gurney or sitting in the back of a squad car from anywhere between 2 to 8 hours, not being able to eat, not being able to use the restroom, not being told what's going on. Now, granted, that is the common. There are, of course, exceptions to that. I see plenty of really caring individuals in law enforcement that try to prevent that as best they can and bring people in and explain what's going on. But you know, that's not what they're trained to do. That's not what they're used to doing. So typically when I see them, I get nothing but questions. What's going to happen? What's the next thing? Where's my mom? I don't understand why I'm here. They usually aren't bringing, a lot of times they're brought in from the community. They're not even brought in from home. So they don't know where they are. I mean, a lot of times I end up telling patients, yeah, you're actually in Colton right now. My name is Dr. Siegler. What I'm going to do is I'm going to talk to you. I'd like to get the information for your mom and dad and try to figure out what's going on. Have you been in this situation before? What did they do last time? What do you want to have happen this time? And just the basic stuff. I mean, I remember when I started, prior to being at Arrowhead, I worked at Riverside. And I remember people looking at me like I was crazy the first time I took a patient off the gurney and walked them down the hall to use the restroom. Because the reason why they were upset and struggling is because they really had to go to the restroom. Very easy, very basic stuff. It's just not hard to do, but it's so easy to just go, well, you know, I'm the doctor. I'm here to focus on the medicine. And, you know, especially in our population that's coming in acute, that doesn't work. If you just focus on that, you start a vicious cycle. And it's a very common vicious cycle that we see in a lot of places that don't have this approach to mental health. And of course, this kind of goes for everybody, not just our children. It's scary to be brought into the hospital and not told what's going on. Of course, it's even worse if you've never done it before. And a lot of our young patients, they never have. They've never been in this situation. They don't know what to do. So more often than not, the first thing that I do when I see a patient is I say, when was the last time you ate? Can I get you a glass of water? Really basic, really simple things. And I think very frequently in this field, people don't seem to understand that this is a service industry. I am a very expensive waiter, and that's okay. I own it. I actually, when I'm seeing my patients, I always end up with, is there anything else I can get for you? Is there something I can do to make you more comfortable? Do you got any questions for me? At the moment right now, we're creating little cards to hand to our patients that include our name, what medications a patient is taking at the moment, and what the next step in their treatment is, whether it's going to a group home, going to foster home, going to just home, you know, an intensive outpatient, what have you. And we give this to our patients because very frequently, much like going to, you know, the dealership when your car's making a funny noise, everything disappears when you get there and you forget things. And so a lot of times these cards actually help people understand, all right, this is where I'm at. This is the medication that I'm taking. This is what it's for. And this is where I'm going. And with those simple, basic things, people actually do a lot better. And our patients really appreciate it. Frequently, I end up handing out several of these cards with our child and adolescent population because everybody wants to know. And a lot of times, even though, you know, this is common in medicine, when you have a family, you usually have one representative for the family that gets the information and then relays it. It doesn't work nearly as well in mental health because things get misconstrued so easily. And so I just try to bring everybody into the room at the same time. In fact, one of my best interventions that I can do over at Arrowhead that requires no medicine at all is to get everybody in one room and start talking, be it on the phone or on Zoom or in person. That family meeting lets me understand what's the dynamic at home, what is happening that is chaotic that's leading to this person to come here. And a lot of times when I have somebody that comes in and they're using certain terms, some certain buzzwords that we all would think of. I have children that come in all the time that say that they want to harm themselves. And I'll say, do you want to harm yourself, or do you just not know how to ask for help? And a lot of times the patient will just say, you're right, I just want help. I don't know how else to say it. And so I'll say, well, you don't have to say that. If you say that, it leads to certain things. But if you talk to us in another manner and just say, I need help, I'm happy to help you. And it actually removes a lot of the fear of me. Because let's be honest, doctors are scary, especially to children. I'm saying this as a 37-year-old man, I still hate going to the doctor. I think most of us do. And when I say these things to my patients and I say, hey, I'm just here to help. You need to tell me what you need so I can try to get it for you. And usually the anxiety melts away. Usually I can get a lot out of that. Even with patients with severe trauma. I actually had a patient just recently with severe trauma at a young age. She was diagnosed with borderline personality disorder. And she had pretty good insight. She understood what she had, but she didn't understand how to deal with it and what coping skills she needed to work on. She wasn't at that stage. She knew she had the diagnosis. That's fine. But she didn't know what to do with it. And so in 10 to 15 minutes of explanation of different kinds of therapies and how her thought process tended to jump certain directions, she was already feeling better. And we were able to prevent a hospitalization because at the end of the evaluation, I actually asked her, do you think if I send you to the hospital that it's going to keep you safe? And her response was, no, I already feel safe because now I understand what to say and what to look for. The hardest part, though, is even though we had these very helpful, healthy, productive interactions, is getting those services as an outpatient. Simple, easy example. My wife had a bit of issues with panic after being T-boned at a high speed, totaled branded car. And she had issues with panic being in the 91 express lanes. Now, you would think I have good insurance. I have a network of colleagues that are in this field. You think it would be easy for me to get a psychiatrist and treatment for her. And it took me months. This is how it is. And it's an issue, but it's also an important thing to point out and something that I always talk about when I'm talking to my families, because I say, you may have to bring your child back to me. That's okay. As you're navigating this, we will try to get you through this as best we can. And it's not a negative that you had to bring someone to the emergency room. Unfortunately, it's a headache, right? Very frequently, patients come into medical emergency rooms. There's not a lot of child and adolescent psychiatry services that are designed like a Psych-ED. There's only about a dozen adult Psych-EDs in the state. Actually, that's one of my big passion projects right now is we are currently working on launching a 20-bed child and adolescent facility with a dedicated psychiatric emergency room. And I'm actually very proud of this one because we've managed to create a really cool little airlock that keeps our adolescent population away from the adult population to keep everybody safe. They actually go directly from the Psych-ED directly into the adolescent unit if they're being admitted, or they can go home. And actually, that's always been my passion is psychiatric emergency, because the vast majority of our patients that come to me, I can usually get about 2/3 to 75% home within 24 hours if I'm actively working and engaging with the patient. Now, granted, that doesn't mean they don't need follow-up care. It is what it is. You need follow-up care after you get stitches. But a lot of times I can get somebody calm enough to work with me and maybe even start a medication if they need it and continue to watch them. And a lot of times they can go home as long as we're focusing on the acute things that led to that person coming in the first place. Now, when it comes to families, it's actually very important, especially in this region. We have to embrace the cultures around us. And actually, it's kind of part of my favorite part of training at UCLA is you have all these wonderful cultures all around you that I was never exposed to until I moved to LA. And I think it's very important in our field that we be very open to learn about these cultures, because I don't know any better. I need to know these things, because in different cultures, mental illness does present in different ways. In South America and uncontacted tribes, very many patients who would be diagnosed with schizophrenia and given medication are very highly functional people. And it's very interesting. In fact, their auditory hallucinations are a completely different manifestation that typically are positive, whereas in our culture, it tends to be negative. So that's just one piece. When I'm talking to patients and I find that they're describing that they're taking their medication as I drink it, when I hear I drink it, I think, oh, this is somebody from the Hispanic community, possibly more of a first generation, and they may have a different interpretation of mental illness than I do. And I want to get to know that about them so that I can do a better job. They call the certain illnesses different names. They treat them differently. And because of that, I want to be culturally sensitive and appreciate that, especially as I'm explaining what Western medicine will do to treat their child. So it's a very important thing to pick up on. And it's actually an important reason why most good residency programs include an entire course on cultural psychiatry, so that they can learn and appreciate that. Because first off, it's fun. And second, you can better treat your patients. Of course, throughout all of this, we have to deal with some chaotic things. Very frequently, I will run into patients who are having difficulties in school. And when I have somebody in school that's having trouble, they typically come to me after their second or third visit to the emergency room. They'll come in and they'll say, my tummy hurts, my head hurts, I feel lightheaded. Usually very non-specific complaints that you can't really work up. You can't do anything with that, right? Tummy ache, okay, give them some Pepsi, right? Give them some Tums. That's all you can really do, especially if they're not, ill or ill appearing and their vitals look good and their labs are fine. There's not a whole lot to do. And so usually after the second or the third time they come in, I'll get a phone call. Hey, Dave, this might not even be a full consult, but can you come and talk to this person for a minute? And I'll go over and I'm very nonchalant. I'll just say, hey, what's going on? What's going on at work? What's going on at home? What's going on at school? And that's when I tend to pick up on some of the most important things. I've caught abuse. Actually, the biggest one lately was someone was struggling with school, and it turned out they were dyslexic and they just had difficulty reading. And I didn't know that until I had them sign some forms. But it was very easy to pick up on. And of course, you want to grab these things because you can get people out of these situations. You can help them with IEPs. You can help them with a lot of different interventions. You can get them help at those schools so that they can succeed. Because, everybody's got something to work on. It's not a big deal. We just want to tailor our approach to the person that we're working with so that they have every tool that they need to succeed. Very frequently, I'll catch people that are either feeling bullied or bullying themselves. Very, very frequently, actually, I tend to get the person being bullied person being the bully rather than being bullied. And that's actually a big can of worms as well, because I want to ask, what's going on? Why are you doing this? What do you need to make yourself whole? And that's usually when I find that there's something going on in the home. Maybe they're in the middle of a divorce. The last one, actually, mother was put on hospice, and I don't think I would be the same well-rounded guy if my parents were that sick too. So these are very important things to think of. Another common issue that I run into all the time is kind of throwing around mental health diagnoses, just like they're, just adjectives. How are you feeling today? Depressed. What do you mean by that? Because my version of depression is very different than I think what you're saying. And I say that to people all the time, like, what I think of when I think of depression and what you're saying, I think are two different things. So let's talk about this. And a lot of times I'll actually sit down and go through either the DSM criteria or, any of the groups of symptoms that you would think of. And I'll have patients say, no, 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 I'm just having a bad day. Okay, that helps. I know what to do with that now. And of course, sometimes I really do catch just depression. Fine, it's no big deal. We can start on that. We can work on treatment. We can work on medications and therapy, but I have to know what I'm working with first. A very common presentation that I see is that people will come in and say that their child is bipolar. Again, I ask, what do you mean by that? I want to understand. And a lot of times I discover that we may have someone with attention issues that can't sit still. It's important as well, but it's a different treatment, right? We don't want to send somebody with attention issues out with mood stabilizers. That wouldn't make sense. And we don't want to give stimulants to somebody who may have the chance of slipping into mania. So I always want to take turns with my patients saying, what do you mean by that? This is what I mean. This is what you mean. And it just brings reality into the situation. But I do it as I'm doing it with you guys. It's not confrontational. I'm not difficult about it. I just say, well, there's a difference between, I think, the verbiage that you're using and my terminology. Just like there's a difference between people saying that their blood sugar is low and people who are hypoglycemic who need help right away, right? We all get hungry, we all get hangry, but there are people that actually are having severe tremors and are at risk of really being hurt. And so we want to separate that out and think about it. And I try to do it in a very direct but non-confrontational way, because this is a common thing in our society. Everybody tends to use medical terms all the time. And, don't even get me started on social media and how it's being kind of trickled in. And unfortunately, there's a lot of miscommunication is probably the best way to say it, about all of it. And it can be very difficult to re-educate people who have come in with a strongly felt opinion about their own health or their child's health. And so you have to do it in such a gentle manner, because it's, how dare you say this? I know this. So it's a difficult thing to think about. Other things that I frequently run into, especially over at Arrowhead, is the sheer lack of beds. There's always a lack of beds, not just for child and adolescent, but for all mental health patients. And my patients, especially on the pediatrics floor, a lot of times they'll have issues with other behaviors and other symptoms because they're in an environment that's not designed for them. They're on a medicine ward, right? A medicine ward is not a place to have someone with just a mental health complaint. It doesn't work. Most mental health units are designed to be kind of a microcosm of the real world. They have schedule, they have breakfast, lunch, and dinner with usually a community room in the middle where people can work on groups and communicate with one another, have games, activities, what have you. And a lot of times in our adolescent units, we have school, and we can't do that in a pediatric ward, right? You can't do that with dialysis going on next to you. So it's very difficult. And a lot of times, unfortunately, keeping our pediatric patients in peds and coming and seeing them as a consult, yes, at least we're treating them, we're doing something, but it is somewhat of a disservice, because it can lead to iatrogenic symptoms that are caused by the environment not being conducive to their healing. So it's very, very important that we try to get them to where they need to be as soon as possible. But this is just a systems issue. This is something that is kind of prevalent for everybody, and it's nobody's fault. But it is something that we need to appreciate and understand, because it allows us to be a little bit more mindful while we're treating that patient, especially when they're not doing well and they're focused on you. Very frequently, my patients will initially be frustrated because I'm a representative of the hospital, and the hospital is keeping them there against their will, and they don't want to be there. And I will tell them, yeah, you're right, we are keeping you here, but I'm just trying to keep you safe, and I am trying to get you to the right place. I just don't have it quite yet. And a lot of times just explaining what I'm doing to get them where they need to go will relieve so much of their frustration and agitation, that they won't end up in negative outcomes. They won't end up in, restraints, which is the last thing I want. I always feel that if any patient ends up in a restraint, it's a failure. And that's an important thing to embrace, because we should go back at every time someone is in those restraints and look back and see, what could we have done differently to make this better? And I actually do that with all of my agitation codes and all of the time that someone ends up needing medication or restraints, because I truly feel that was a failure of the system. So we go through and we look, what could we have done different? Oh, this person was trying to make a phone call and the phone wasn't working. We could have handed them a cordless. Oh, they were trying to get the nurse's attention and they just simply wanted a glass of water. This is a very common thing. And it's actually very important in my style of care, because I do truly love inpatient work, but people are the sickest of the sick. And unfortunately, that means that a lot of their rights are taken away. And it's very different and very difficult to go from your home environment, where when you're hungry, you just walk to the kitchen, open up the fridge and take what you want, to having to ask somebody for something, for everything. And it's even more difficult for our child adolescent population, because very frequently, these are all strangers to them and they don't want to ask and they don't know how the system works. So a lot of times they'll go without until they can't go without. And then they get upset. And that's when I get called. I actually have an entire team dedicated to de-escalation and talking to people before they need any, the negative interventions that happen in the field. Literally, we even have a name for it. We call it the BERT team, Behavioral Emergency Response Team. And we come in before somebody gets really upset so that we can try to make their needs met. We actually have dedicated members. It's a multidisciplinary team, but we have 4 positions. One is the person who negotiates with the patient to talk to them and ask what their needs are. Usually that person is whoever has the best rapport. And a lot of times it is me, but sometimes it's, a janitor on the floor that just so happens to be having good conversation with the patient. Of course, we have somebody available to help with medication. That's usually a nurse, because they have to operate the Pyxis. But then we also have kind of a general gopher, because a lot of times people get upset because they need to use the restroom or they need to eat. These are very basic, minor things that are the reason why they come to me in the first place. And then we have a history person, and sometimes that history person is very frequently a resident, because it's the resident that's in front of the patient all the time talking to them. My last one, though, was actually a very, very strong medical student who was working on doing some processing therapy with a young lady, and she was able to tell us what was going on so that we could treat her better. Now, I know I'm kind of going all over the place here, but kind of my style. But as you can see, this is how I work. I have to kind of fly by the seat of my pants on roller skates, because I don't know what I'm going to see every day. And sometimes I don't get to see any adolescents, and sometimes I see over a dozen. And honestly, both are good. But I do have to embrace those changes and embrace those very quickly evolving cases, because they do move very quick. And you do have to think of a lot of things at the same time. But it's also what makes it fun. That's all I've got.
Thank you so much, Dr. Siegler. That was really powerful. And I have a feeling that we've gotten just a really, really small sliver of what you experience every single day, and how you have to process this yourself internally. But thank you for all you do for helping our youth. That was outstanding. Thank you.
Thank you.
All righty. Well, now we'd like to go ahead and turn over our program to our IECHI board member and chair of the IECHI Advocacy Task Force, Dr. Danielle Kilkenstein, Dr. PH. Dr. Kilkenstein is currently the Executive Director for Government Relations for the Inland SoCal United Way and Inland SoCal 211 Plus. Dr. Danielle, thank you for taking us into the next segment of our program. Welcome.
Thank you so much, Allison and everyone. And I just want to start off by saying thank you to Allison and the San Bernardino County Medical Society team, also the IECHI and their team, our panelists, our partners, just everyone for being able to collectively work together to support and impact, positively impact our communities, our health and well-being of our children and families in our region. So just thank you so much for the opportunity to be with this amazing group of folks. And it is my privilege and honor to be able to move us into the next portion of the program. And I'm going to introduce our esteemed panelists. So first we have Dr. Lexi Backstrom. She serves as the Administrator of Student Behavioral Health and Support for the Riverside County Office of Education, where she oversees behavioral and mental health services for alternative education and care space as part of the Superintendent's Mental Health Initiative. Dr. Backstrom brings over 10 years of experience developing programs and supporting the behavioral and mental health needs of students in non-public schools, residential treatment centers, K through 12 school districts, and alternative education. Her degrees, credentials, and licensures are a lot and include, she has a doctorate in educational psychology and applied behavioral analysis, an EDS in school psychology, a master's degree in counseling, an MBA, a clear administrative services credential, PPS in school psychology, a licensed marriage and family therapist, and she is a licensed professional clinical counselor. So thank you and welcome to our panel. And next we have Evans Sternard. Hope I'm pronouncing that right. He is a counselor and professor at Crafton Hills College. And Professor Sternard holds a bachelor's degree in ministry and has multiple master's of science degrees in school counseling and counselor education. His areas of specialization include clinical counseling and mental health. And the professor has decades of experience, including youth ministry, marriage, family, and individual therapists, high school counselor, and dean of students. He was an adjunct professor for Chaffey College and also Crafton Hills College, as well as a counselor for Crafton Hills. He established and co-chaired the CHC Behavioral Intervention Team and is a published author with a work titled Stress, Anxiety, and Well-Being, Navigating the Waters, which was published in 2019. So welcome and thank you, Professor, for joining us. And last but certainly not least, we have Rebecca Cloud. Ms. Cloud is a licensed marriage and family therapist who works in the Student Services Counseling Center as a clinical compliance supervisor for San Bernardino County Superintendent of Schools. She works with alternative education school sites in San Bernardino County and has been with the county schools for 15 years supporting programs for high-risk teens. She earned her bachelor's in psychology at UC Riverside and her master's of science in counseling psychology from California Baptist University. She's currently involved with kids in grades 7 through 12 who are attending community school and are often involved in the juvenile justice system. So welcome and thank you for joining us. So we're very excited to have you all and your depth of experience here to share with us. And so we definitely want to hear from you. So we'll go ahead and jump right into the questions, if that sounds okay. And Dr. Backstrom, we'll start with you, if that's okay. So the first question is, what is the most urgent mental health challenge that you are seeing for our student learners, specifically kids in K through 12 and in college?
Awesome. Thank you so much. It's so great to be here with all of you today. I think visuals are very helpful. So if it's okay with everyone, I am going to be sharing a few slides with you as we go through each question to be able to comprehensively address what's been asked. These slides will also be available to you afterwards. I have shared them with our team here so that they can send them out to everyone that has been participating today. So I really wanted to share this report with you all because obviously as practitioners, obviously have three therapists that are on this call as panelists today. We know that anxiety and depression have been at the forefront. But the reason I really liked this report is because this report looked across the entire state of California. Mm-hmm. And so 1,200 students were surveyed, and this included grades K through 12. And you can kind of see some of those demographics there on the right. Our state looked at 46 school districts across 23 of our our counties. And so when they were asked that question of how did the pandemic affect you, as I mentioned, anxiety and depression came as number one, but stress was also there as well. And so I really wanted to kind of highlight this is still a concern for our youth. And, you know, as someone that serves directly with our youth in community schools and court schools as well in alternative education, we see this day in and day out as our students receive services from our therapists. But also, which I'll talk about a little bit later, we have our care spaces, and that serves the whole county of Riverside. And that's, again, the number one thing we're seeing is anxiety and stress. But you'll see right under that is our physical health. And so I think that's another huge component. You see grief on here, you see burnout. And so just understanding that even though, you know, we are coming out of the pandemic, that these mental health concerns are still a huge area. I want to kind of touch on those college and adult pieces as well. And so this is some data that's showing the percentage of US adults across our country that were reporting anxiety and depression in 2019 versus in 2021. So obviously we've gone from 11% to 41%. So again, really highlighting those main concerns around anxiety and depression. If you're not familiar with the SAMHSA Distress Hotline, this is a 365 24/7 guideline that you can reach out to get counseling, guidance, and support. And so we saw again in that 2019 through 2020 from 1,700 to 20,000. And so I think, as I mentioned, the biggest thing is really just focusing on, you know, the anxiety, the depression, and, you know, unfortunately, I'd like to say that the college kids and the adults are handling it better, but we're not. We're all struggling, and it's a huge need across the board.
Well, thank you for sharing that data, especially, you know, it's seeing the jump. I mean, I think it's something we all kind of known, kind of, you know, just if seeing ourselves, but really seeing the numbers there definitely puts it into perspective. So I appreciate you sharing that. Professor Sternard, what do you see as the most urgent mental health challenges for folks that you're helping?
Well, I would echo what Dr. Backstrom said, and she said it very well, by the way. The stress and anxiety is oftentimes almost through the roof. I give out a survey. I teach a class I was able to develop, and now I teach a class called Stress Management and Emotional Wellbeing for college credit. And I give a survey, a depression, anxiety, and stress scale that's well researched and well validated. And I do this, it's a pre-test, post-test. I do it at the beginning of the semester, at the end of the semester. And typically I find that roughly half to 2/3 of students will measure either severe or very severe on at least one of the three domains, stress, anxiety, and or depression. And they're coming in just overloaded to the college scene. And I found the same thing really when all my years in working as a high school counselor. I think it's really important for us to take a look at that table that Dr. Backstrom shared, and I think it's very sobering and a little sad that the third most commonly expressed symptom is burnout. I used to think burnout was, oh, that's for a mental health clinician who's been working 10, 15 years and isn't really knowing how to take care of themselves, and they're just fried and they're at the end of their rope, burned out. These are teens in some cases. And so a lot of times what I will do in my classes, and I also lead support groups here on campus, is how can I help you take better care of yourself? How can I help you to really be a self-nurturer? Because many of the times they will share things with me like, or it's evident that, you know, nobody really cares about me or has helped me to understand that I'm worth caring for. And so helping them to realize, okay, maybe you're the only person in your life that's going to take care of you. So how can I help you do that mentally, emotionally, physically? Because a lot of times since they're dealing with all the stress and anxiety and the depression that oftentimes goes with it, as our keynote presenter said, they don't really know how to reach out and ask for help appropriately. So connecting them, one of the things I do here at Crafton is I connect them with a variety of resources that we've set up here to give them mental and emotional health and support, like clinical counseling, support groups, and some of those things. So I think for those of us that are all here today, since we're all involved in some way or another in the domain of caring, for me, what's important is the idea of coming alongside. How can I come alongside you and help you with whatever difficult thing you're dealing with in life right now? I have no idea if I answered that question adequately or not. Those are just some thoughts that are on my mind quite often.
Yeah, no, that's very helpful. And I really appreciate your mention of the burnout. I think, it's something I think we're all seeing has been increasing with the need. And to your point, like how exactly do you get the help? Like figuring out, how to navigate that is important. So thank you for your advocacy and all the things that you're able to do to help, our student learners and those who need help the most. So Ms. Cloud, do you have any other recommendations or any urgent needs that you're seeing with mental health challenges and in the kiddos that you're helping and young
Sure.
learners?
Sure. Yeah. In the population I work with, the biggest issues that we see are exposure to violence and trauma. We have a lot of that. So these kids are coming in with a lot of baggage, and unfortunately, that results in a lot of substance use. Access to services is a big issue as well. Fortunately, on our campuses here, we have mental health clinicians on each campus, but our kids have not had that support before. A lot of stigma against mental health also, that it's admitting weakness, or it's with the families, with the culture, a lot of stigma against mental health. So our kids are often more than willing to self-medicate with things they can get on the street, but when it comes to actually taking prescribed medication, it's very much not encouraged at home or seen very negatively. Yeah.
Well, that's definitely important and something, the trauma, the ways that people are dealing with the various items it's important to know. So that way we're able to work together to address it. So thank you for highlighting that in particular. And Dr. Siegler, I know that you had mentioned a little bit, some, kind of in your talk, some of the things that you were, kind of experiencing with some of your folks, for example, the Maslow's hierarchy of needs, right? Like if, basic needs aren't met, then it's hard to really understand what other kind of challenges are there. Do you have any other things that you wanted to add in for the most urgent mental health challenges that you're seeing?
Honestly, the most urgent mental health challenges that I'm seeing just in general are, of course, substance. I see it's my bread and butter. In fact, the reason why I can so comfortably and confidently say that almost 2/3 of my patients can go home within 24 hours is because many of them are acutely intoxicated, and that intoxication syndrome wanes over that period of time as your body metabolizes the intoxicant. And so one of the biggest things that I think that we need more specific treatment for is substance use. It's actually the most requested service in every inpatient hospital and the least delivered. We're actually working on trying to get an addiction service going here, and we're making progress, but it takes time because, of course, that requires funding, and funding can be difficult at times. And I know that the state is putting funding out in large buckets, but those buckets aren't always the easiest to get a hold of. I mean, as I brought up earlier with my child and adolescent unit that I'm working on, that was a very specific grant that I was able to get that I had to apply for and fight for. Because a bunch of people are fighting for it. It's a good thing. I don't care if it's my service. I just want the service to exist. And addiction is just the next layer that I'm trying to focus on next, because there's definitely not enough physicians that are trained in addiction. There's plenty of people that prescribe medications that can be addictive, but don't have the addiction training to really understand what they're doing. And a lot of people who come in with pain inadvertently are creating their own opioid use disorder, and it's just chronic pain. It's not their fault, but a lot of times, if they were to get in front of an addictionist, they could still have their pain treated, but they could also remain much more functional.
Thank you for sharing that. I mean, there's definitely a lot of challenges and urgent needs that you all have been able to highlight with data and things that you're seeing, which is very important. So I know some of you started to touch on it. So kind of going into the next question about what are the most effective methods that you see for supporting youth in the school setting? And I'm wondering if Professor Sternard, we can start with you, because I know you started to touch briefly a little bit about the clinic support groups and some of the ways that you are addressing some of the needs. So I wondered if you would be willing to talk more about effective methods for supporting youth in schools specifically.
Sure. How much time do I have? I'm joking. I'm joking. By the way, I prefer to be addressed if everybody's comfortable with just plain Evan. You can see by the way I dress, I'm very informal. So I was thinking as Dr. Siegler was mentioning the prevalence, and we're all aware of it, of intoxication and substance addiction. And one of the best things I think that any of us here can do is because I come from an alcoholic family background myself. My dad was a problem drinker, and I struggled with that for several years when I was younger. And the question is, how can I help them to find and develop a healthy normative substitute for what they're trying to get by being intoxicated? In other words, how can I help folks that I encounter, whether it be through teaching classes or one-to-one sessions or small groups? We're talking about things like finding a sense of personal worth and value, which for many of the students we work with is basically rock bottom. Okay. Personal worth and value. Do I really matter? Am I worth something to somebody? Do I have something to contribute to this world? Is there a meaning and purpose for my life? Helping them to find those, because I know that once I started to develop those things, the need for intoxication became less and less. And those foundational things, and we can talk about programs and services, and they're very important. Those foundational things are one of the ways that we can at least help students and young people, whoever we work with, begin to deal with the emotional pain. And by finding a sense of, why do I matter and do I matter? I think talking specifically is about specific things. When I teach my classes here and when I lead support groups, fostering an attitude of, you know what, I'm not normal, but that's okay, because most of us are struggling, and that's fine. I'm in good company. When I struggle with this thing, and when I deal with this thing, and when I'm anxious, and when I'm fearful, and my stress level of a 1 to 5 is at a 6, am I normal? And fostering the sense of, yeah, you know what, not only are you normal, you're in good company, and we're here for you. And yes, that's one of those unspoken things, a kind of an atmosphere thing to build, but by whatever means we choose to provide those services, keeping those things in mind, coming alongside and helping them to feel accepted and normalizing what they're dealing with, so that they can begin to take steps forward in the healing process. I hope that makes sense.
That does. That's really helpful. And I like how you talked about healthy substitution, right? Like making sure we let our kids know that they do in fact matter, and that there are other ways, right, that we can be healthy. So that's really important. So thank you for sharing that. I appreciated that.
You're welcome.
Ms. Cloud, do you have, what do you see as the most effective methods of supporting youth in the school setting?
What I see as being really effective is working collaboratively with school staff, with the teachers, with the parents, with administration, and in my case, with probation as well. When these kids know that they are valued and that they're important and that they're truly cared for without strings attached, I think it makes a huge difference. So a lot of our work here is just coming alongside them, meeting them where they're at, accepting them for who they are, and helping them to work through their, their trauma, their grief, their anxiety, depression, whatever it is, and also normalizing where they're at. I see kids that are, they're labeled the bad kids. They're lovely kids, but they've been through a lot. We're kind of the last line. So And them coming here, just having services available to them. And even at district schools, I think it's very important just that kids have access to services on a consistent basis.
Thank you. That's really helpful. I like how you talked about no strings attached care specifically, right? Like that really comes to the trust issue, right? Like it's going to be very difficult to help our youth and young adults if the trust is not there. So that's definitely an important piece. So thank you for highlighting that. Dr. Backstrom, what are some effective methods that you use for supporting youth in school settings?
Yeah, absolutely. I think Evan and Rebecca hit the nail on the head. It's the relationship piece, it's the trust. And, I think if we're all working in that direction, we're going to see a lot of positive impacts on our youth. And, Dr. Siegler talked about that as well. His first and foremost is, how are you? How can I help you? What do you need? And you know what, for some people, that's really, really hard to be that relationship person. I think it comes very naturally for us because, this is the field we're in. So I wanted to provide some other kind of research-based and practical tips that, may be a little bit easier to implement or in addition to what you're hearing today. And so I'm going to go ahead and share my screen again. And I'm going to kind of touch on that research that I just shared with you a little bit ago about that wellness report and those 1,200 students across our state. So when they were asked the question, what should your school do to provide more support? Obviously, you can see on the bottom there, which I was kind of surprised. Number one came in as individual academic counseling. So what that's telling me is our kids are saying that they're struggling with those academic pieces, whether it's what classes to take, how they can graduate college or can graduate high school to start college. And so that became number one. And when I started thinking about, stress being a huge factor for our youth and our college students too, that made me better understand, okay, academic advising is huge. And that's just a shout out to our school counselors and all the work that they do supporting our students. Number two, which shouldn't be surprising, they want more counselors, they want more psychologists, they want more social workers, they want more nurses, they want more Rebeccas and Evans in our schools. And that doesn't surprise me because, we all do amazing work as clinicians, and we really provide that relationship piece that we've all been talking about. Extracurricular activities, sports, college counseling, tutoring. Everyone should be aware, if you're working in a K-12 system, of the ELOPs that have come out through our state and all the funding that's available for that. And so I'd really encourage you to look at your extracurricular activities and give students surveys. What are they interested in? What do they want after school? A lot of these are being led by your teachers through extra duty through ELOP. So just kind of looking at some of those pieces of, is it knitting? Is it robotics? Is it cooking? What's available for our kids so that they can feel more supported and connected. And again, that builds the relationships. On more of a qualitative piece, I'm not going to go through all of these, but these are the qualitative themes that emerge from supporting students. And we heard Evan talking a lot about this as well, through that self-care and that mental health and realizing that you're valued as a person. So this is what they like to do. They like to journal. Teenagers like to sleep. No surprise there. Listening to music, right? And watching TV. Those relationships, we're going to just keep talking about relationships because that is so critical. And it goes beyond the school, right? We've got pets on there. We've got our relationships through social media. Obviously, that's not the number one way to do it, the physical in-person connection, but that's important to our kids and understanding that. And so these are all of the things that our youth across our state are saying is important to them and what helps them. And then, of course, we have our hobbies and creative expression, which again, we can tie into some of those extracurricular. Do you have art programs on your campuses? Do you have music programs? Is there opportunities for sports? And again, this isn't just K-12, right? In colleges, are we providing these opportunities for our students, giving them opportunities to lead as well, right? We see so much research around that peer-to-peer piece. And so just providing all of that to our kids and letting them have the opportunity to choose, because as we heard, we're all different. We all have our own unique strengths, and making sure that we are finding opportunities for kids to feel connected on campuses.
Thank you for sharing that. I mean, I personally love data points and being able to help me understand and also convey the need. So I really appreciate that. And also, I think to your point of kind of meeting folks where they are, right? Like figuring out where they are in their journey and where you have to start, building that trust and working with them along in that journey to make sure that folks are able to get all of the support and everything that they need. So thank you again for sharing that. Dr. Siegler, I know folks have referenced you, but was there anything else that you wanted to add before we move on to the next question?
No, other than I wholeheartedly agree. I mean, I think we're not purposely being an echo chamber, but we're also aligned in our approach that it's actually, it's nice to hear, because I can't tell you how many times I'm doing a consult in trauma and they're telling me that I'm great. So it's nice to hear that I'm doing the right thing.
You are very much doing the right thing. And I love your collaborative, informal approach, because most of us, whether we're in trouble or not, can identify with that. And folks that come in and are needing help, you know, if I'm presenting myself as a professional helper and someone who hopefully has some answers, but if I'm also presenting myself as a real person with flaws and foibles, just like you, wow, it's like I'm like, I don't do much gardening, but it's like I'm cultivating the soil. I'm preparing the soil of that person to receive the specific helps that I can give them.
You build a culture of wellness and caring.
And all hands on deck, right? Because it takes all of us working together. So thank you all for your advocacy and your efforts in doing this every single day. So we definitely, outlined some of the needs and the challenges and some of the effective methods in supporting our youth in school settings. But I'm wondering, and if Ms. Cloud, maybe you can start first on this one, what additional resources are needed for not only just for our youth, but for our professionals who are supporting youth? So like for you all.
Sure. On my soapbox again, but I think access to services is huge, both on school campuses as well as in the community. I know the services are out there, but a lot of times people have difficulty accessing them. I've experienced that even having insurance with my own children. It's not easy. So I can't imagine how difficult it is for people who aren't in the field and who aren't familiar with what's out there. I would love to see some inpatient services available for youth and drug and alcohol. As stated earlier, that's hard to find out there. I think also it's really important for the families and the children to have a better understanding of mental health and to help them, work through that stigma and to see it as healthcare. It's part of healthcare. It's part of wellness. It's just like taking care of our bodies is. In terms of for professionals, I think it's really important that we take care of ourselves. I think that's the highest source of burnout, especially with what we're exposed to, is self-care.
Thank you for that. We could all definitely use self-care. I think I'm just throwing that out there, maybe speaking for myself, but I liked how the conversation earlier was like making sure that, we feel worthy enough in ourselves to be able to ask for the help that we need to be able to thrive and be able to reach our optimal health. So thank you so much for that. Dr. Backstrom, what additional resources are needed for youth that you're seeing and also for professionals that are supporting youth?
Yeah, absolutely. And actually, I've been blessed and given the privilege to lead our superintendent's mental health initiative care space program. So I want to show you what it is that we've developed here in Riverside County to encourage others to develop similar as well. We heard Rebecca talk about the access piece. So I've created Care Space, which is 11 physical locations across Riverside County, and we serve the entire county of Riverside. So whether you're a staff member needing mental health services, or whether you're a student or a family member or a community member not tied to the school, we'll serve you. And so that was part of our goal when we were looking at that access piece. And these are all of our community partners. We couldn't provide Care Space without them. And so I just kind of want to show you a little glimpse of what that looks like. And so on the right, you're going to see 2 of our Care Space locations. And so one of the questions is, what do our youth need? First and foremost, they need a safe space. They need somewhere that they can go to receive services. And if they're not ready for services, that's fine. They need somewhere where they can go, where they can just hang out and chill and be able to just relax. Rebecca talked about self-care. Our kids need self-care. We need self-care. And by us providing those spaces, that's the first way we can do that. And then once we provided those spaces, what can we offer through those spaces? spaces? Can we offer counseling in those spaces? And so for us, we offer individual counseling, family counseling. We do parent workshops. We do classroom presentations for students. We actually go to schools across our districts, staff training, other resources and referrals, right? We heard that that's more than just mental health. It's food, it's clothing, it's housing. We provide that as well. And then we have a special service for our TAY, our 16 to 25-year-olds. And then of course we have our Lucky Paws, which I'll talk about briefly, but that's our pets or wellness support. And so we know that animals play an integral part in our mental health. And so by partnering with the Department of Animal Services, we are able to bring pets into families, and we waive all those adoption fees for them through our generous donors. And so I just kind of want to highlight a few of these services that we offer. As I mentioned, we go into schools to provide these presentations to students, again, kind of destigmatizing mental health. And so as a district, as a resource, obviously you don't need to serve the whole county. We're the county office. That's why we're serving everyone, but serve your own students, serve your own families. I think one of the most challenging things is we don't offer family counseling in our districts. We're trying to address services with just the youth. We need that family piece as well. We offer those parent workshops. They're all completely free. Anyone, that has access to our website, which I'll share with you briefly, can go in and they can look up these workshops and be able to log in. They're completely free of charge. We change the topics every single month. And so again, just another, resource and way that we're, moving beyond students, but also connecting to our parents and our families as well. And then, as I mentioned, that Lucky Paws service, right? And so these are two of the Lucky Paws that inspired me to start this program. My husband said after 4 dogs and 4 cats, I couldn't have any more. So we had to figure out some way to continue to, help the animals, but also understanding that animals reduce anxiety and depression. And so many people out there may want an animal, but they can't afford a pet. And so that's where we kind of come alongside them. And so this is Royce. He's one of the little boys that we helped adopt a kitty through our program. This is Miss Bowser, and Royce is from Menifee. And then we've got Jasmine, and she adopted Jinx and Powder. And so we're just really trying to support in any way that we can across our county. So as I mentioned, we've opened 11 locations. We've had 5,500, we're over 5,500 individuals receive services through us in just the last 2 years. We've provided over 4,000 free counseling sessions. Obviously, we've increased emotional and mental wellness. We do, as Evan mentioned, a lot of questionnaires, a lot of feedback to make sure we're actually making an impact based on beyond just the numbers of individuals served. And we've supported 23 of our school districts. And so for us, that's one way that we've found a lot of success. As Rebecca mentioned, it's always, well, you don't have the right insurance, or, you have to wait this long or whatever. And we've really tried to breach all of that. So you don't need insurance. You don't need to have Medi-Cal. You don't need to have IECHI. You can come to us and we will serve you. And so that's one of the things I just really encourage is, serve the students and the families that you have in front of you. And wellness centers is a great way to do that. We also will go to your events as well to help promote our services. And so we have an internship program. These are actually college students that are looking to graduate in their degrees in psychology or sociology. And so they come along board and they do 3 things. They do events like you've seen here. They also do peer mentoring. And then if you notice back here was actually Natalie over here in the corner doing a classroom presentation. So they actually go into our districts to do presentations as well. Why college students? They're close to our students in age, right? Our kids can relate to them. Most of them just graduated high school. Both these students are bachelor's level students. And so it just gives that opportunity to, again, connect with our youth and our families, and again, help promote our services. And so through this program, we've served an additional 3,500 separate from the 5,500 of direct services. And then kind of just touching on that professional piece as well. Obviously, all professionals can come to CareSpace and receive free services too. But we really need to look at our data across our state. And so all this data comes from Cal Matters. We have licensed behavioral professionals increased, which means there was more added to the field in 2016 to 2020 by 20%. However, as we know, the staff shortages have escalated due to the pandemic. So even though we added 20%, those shortages are higher than ever. We heard the talk about burnout. As you heard Dr. Siegler say too, we're having more mental health concerns, obviously a lot different than what we saw 10 years ago. And this is just very striking data. 45% of psychiatrists and 37% of psychologists are going to be retiring in the next 10 years. So what that means for us is by 2028, the demand for mental health services are going to be 40% more than the supply. So we've got to do things that are taking care of our staff, taking care of our students, and taking care of our families, because if not, we're not going to have anyone to take care of anybody. And that's obviously a huge concern. I like sharing this because, again, I'm in education, obviously. But look at this. We've got our principals, we've got our teachers, and we've got everyone non-education. So we've got frequent job-related stress at the highest it can be in education. And everyone else's career is a little bit less stressful. Similar things with burnout, symptoms of depression, not coping well with job-related stress, resilience is lower in education. So again, I just want to remind everyone that this data is real. Our professionals are struggling. We may not look like it on the outside, but when you're, seeing all of these students and being a therapist and seeing all these clients, like, you take on their trauma. It's called secondary trauma. It's a very real thing. And so being able to take care of our staff and take care of each other is just something that we need to make part of our culture each and every day so that we can support all of our professionals.
Thank you. I mean, here, +1, +5. Thank you for sharing all of that data. Also, I also just wanted to note your efforts in bringing in kind of the animals piece of it. And I think that is really helpful. And I think a really great way of, helping kind of build that trust and allowing folks to have that access where they might not otherwise have it. So thank you also for sharing all of what you're doing. And we'll make sure, I'm speaking hopefully not out of turn, but we will make sure that we are able to share all of those links and flyers with everyone in our group. So Professor Evan, what additional resources do you feel are needed for youth and also for professionals uplifting youth?
We could do a seminar on both of those topics, couldn't we? And we would not exhaust the possibilities or the needs for them. First of all, I want to say, Dr. Backstrom, in all sincerity, whether they pay you, it is not enough. I am most impressed. I want to go back to what we can do for ourselves. And I really love, Dr. Backstrom, the fact that you shared the levels of stress and burnout among providers and educators. And when I teach my stress management class, one of the assignments I always have, in fact, that's the capstone assignment, coming up with your own personalized stress management and well-being plan. And it's multimodal, and they have to be specific and measurable, and all those kinds of things. Like, so how are you going to be taking care of yourself in a multimodal fashion 6 months to a year after this class is done? Well, my challenge for all of us, and boy, I'm speaking from my own personal appearance here, are we doing that ourselves? Is each of us, do we have an intentional self-care plan? Because we all would probably acknowledge, yes, that's important. Yes, I need to work on that. That's good. But what are we doing specifically, socially, cognitively, emotionally, physically, to take care of ourselves? Because people are coming to us in a sense because their personal well is dry. If my well is dry, how am I going to give away what I don't have? And so my challenge, and then we're going to move to the resources for the students in just a second, but for all of us, the task is, how can I take better care of myself in a holistic way so that when I come to my job, I can really give away meaningful things to other people. And one of the key things in this, and this would be another subject for a presentation, is the setting of boundaries. Am I able to leave the job at the job when I go home? Because most of us are familiar, for instance, and maybe this is just a guy thing, when guys meet guys, what do they ask each other the first thing? So what do you do? Who we are should not be the sum of what we do. And identifying that and living in that, making that a reality is so important for us. In terms of shifting gears quickly and resources for students, I want to show one thing that we've done here at Crafton in terms of, I think about the student, midnight, 1 a.m., they're all alone. Maybe they're at their college's website because they're a student, they don't know where else to go, and they are in a deep, dark place. So how are they going to get some real-time help before the sun comes up? And so if I may share my screen for just a moment. So something that we have as part of our Crafton counseling screen, we have these different topics or different things. These emotional mental health resources, I was able to put some of this stuff together And so when they click on the counseling resources here, some of you may be familiar with the statewide Each Mind Matters movement, which I pitch every chance I get. But this is our Each Mind Matters. I call it our landing space. And we have some things here on the right so that students can check those things out. And there's an introductory video, but really the heart of it comes from here. Students can access these things. They can find out about support groups, community counseling services that are low cost, no cost. They can find out about the mental health counseling that we have available on campus to each student. And then this especially is something that I really work hard to bring to the website. It's a little self-use library. Again, if they're home late at night, I am feeling so anxious about these upcoming tests. What is there help for me? And so they can click on the anxiety, and there is a list of, and these are updated resources to help them with their anxiety. And then there's also a collection of videos that they can look at for real-time help right now. Again, it's 1 a.m. I need something before the sun comes up. And so they can do that. And maybe as they're scanning this page, they're thinking, you know what, maybe it's not so much anxiety. Maybe it's just I'm really stressed. So without even having to hit the back page, oh, stress management, what is that all about? So there's some things here. And then again, there's some videos here that have to do with managing stress appropriately. And so for each of those areas, there is real-time help available to them. And so just getting the resources out and publicizing it, and that's involves with that whatever entity or organization that we are with. We may have to stand on our soapbox and wave our hands and say, look, these things are important. How can we as an institution or a service provider make these resources instantly available? Because we all know that if a student is really feeling like they want to end their life at 2 a.m., they don't want to have to click 5 times to get help. So how can that be front and center right now that I can find easily? We can help do that for our students and the populations that we serve.
Thank you. And thank you for sharing those resources. We'll definitely take them, copy them, and share them out with our groups as well. And I just wanted to note, I really appreciated your comments about, self-care plans. The way that I try to remind myself is like being on an airplane, right? Like we have to put the oxygen mask on ourselves before we're able to help anyone else. And so in order to maintain our strength, we need to take care of ourselves too.
And,
So
and most of us are familiar with the term intentionality. And the key to this is I need to start taking care of myself before I reach the burnout point where I am no use to myself, my family, or anybody else. And that's the key. Let's be proactive.
Agreed. Let's be proactive and let's increase our workforce and have everyone so we can all take breaks what we need. Just throwing that in there. So Dr. Siegler, we're getting close to time. So I wanted to know, we were going to have one more question for our lovely panels from me before I turn it back over to Allison and her team to go through any questions on the chat. But first, Dr. Siegler, was there anything else that you wanted to add about additional resources that are needed?
As we've all discussed about, burnout, taking care of ourselves and what have you, one of the things that I am doing over here at the hospital right now is I like to give a lecture once a quarter on compassion fatigue. Very, very frequently, my staff, my nurses, my psych techs, basically, even my residents, because we're dealing with people that are so sick, and possibly even dealing with other, more nefarious issues, it's very hard to keep your batteries charged. And just like we've all hinted at, being very mindful and knowing what, oh, I need to do something before it gets bad. I mean, it's quite common. I call my dad on the way to work every day, and I go for a walk with my wife and the dog every evening. And I'm not the same guy that you're talking to right now if I don't get 50 to 100 miles a weekend on my bicycle. Just what I like to do, and it helps me. That's actually my meditation time. But one of the biggest things that I have really seen lead to a change in our culture and the happiness of our providers here is the embracing of the fact that, hey, you're allowed to be frustrated with a patient. You're just not allowed to lash out at them. So take a step back and let it out. It's quite common that you'll have a little bit of dark humor in the nurses station because we're supporting each other. But you have to make sure that you draw that line in the appropriate manner so that you're not affecting care and you're not allowing yourself to take it home as frequently as we all do.
Thank you for sharing that. And I know that we're getting to time, so I just wanted to throw it out there, and whoever wants to jump in first can, but are there any other thoughts or ideas that you wanted to share, and specifically touching on anything that you all would recommend that's needed from families of the youth that you're serving in communities? So how can families and community partners better support you in your efforts in helping youth, or any other thoughts that you want to share? So if we could keep it very brief and wrap it up, whoever wants to jump in, feel free.
I would say enlist the parents as partners. How can I help you work together to partner for the well-being of your young folks that are in the home? How can I equip you to help them? That's very important, because parents know that they can contribute meaningfully. That's a sense of empowerment. We all know how important that is.
I would say, I think Rebecca and I probably run into the same problem, being that we're both at the county office with Ed.D, and that usually the reason our kids have gotten to us at this point is because there's not a lot of parent involvement. And so I would really, really echo everything Evan said. We need partnership with our parents. And I will do the flip side as an educator and play the parent role. As parents, we need our education system to want to partner with us. And I think, unfortunately, sometimes where we might be more vocal and we might go to the school and say, my child needs this because I know that they need this, as educators, we need to listen. So I'm going to flip back and say, as an educator, we need to be better listeners of our parents, and we need to do a better job of inviting them to be part of it. And I'll just share really quickly, one of our community schools, our principal does a barbecue and invites all of our parents once a month to come to the school. And I will say, I have never seen a bigger turnout at any of our sites besides his site, because he literally has 90% of parents participating because of that barbecue piece. And he's built those relationships in that community in his school site. So more barbecues, more food, and truly listen to your families.
I love that, and I completely agree. My biggest thing would be parental involvement, getting them involved in treatment, and also having compassion for our parents and for our families in developing those relationships.
Thank you. Dr. Siegler, any last words before I turn it back over to Allison?
I would only echo all the same things that we're all saying. So I think that we're definitely delivering the right message here. We need to take care of our patients, take care of ourselves, and think of the little things.
Mm-hmm.
Yeah, and thank you all so much for being here and for sharing all of this and for allowing us to be, collaborative partners with you in this effort, because we definitely all support and are happy to, walk along this journey with you. So just wanted again to say thank you so much to all of you, not only for being here today, but for just all that you do each and every day. So with that, I'll turn it back over to Allison, because I do know that we have some great comments and questions in the chat.
All right. Thank you so much, Dr. Danielle. Thank you, all of you, for all of your insight on that. That was outstanding. We appreciate everything that you're doing. All right. So I'm going to actually ask my colleague, Soteria Cobb, to start going through our questions. We only have a couple, but I want to encourage you guys to continue to add some questions into the chat, or you can raise your hand, but we'll start going through them in order here. Soteria.
Okay, well, we have a few comments I'm going to read real quick. First comment is from Brian Berry, and it says, some common sense tips, just not commonly practiced. Sounds like an opportunity to further educate physicians and practitioners on compassionate initial contact, and a great resource is, and it's koalabyouth.org, so it's all in the chat. And then I have a question from Allison, our very own Allison. It's a question for Dr. Siegler, interested in the different cultural approaches Perceptions to mental health issues with our youth. Can you give us some examples?
Actually getting ready to write that answer in the chart. So many of my patients happen to be, first generation transplants from Hispanic countries. And actually, I have to do a lot of education when their loved one might be having their first break. The first research poster I ever did actually was about my training hospital, all of UCLA. Very, very interesting place, based out of Silmar, very heavy Hispanic community, actually a interesting hotspot in the entire country for neurocystic psychosis, because many families bring their pigs from their farm in Mexico up to have farm in Silmar because there's farming land there. So it's not the same regulated pork, and it can lead to parasites. Now, that's not actually the example I meant to bring up, but if you were to go work at all of you and go to the internal medicine floor, surgery, what have you, basically the hospital is monolingual Spanish. And so you either need to have a translator with you at all times, or you learn Spanish. But of interesting note, the mental health unit, everybody spoke perfect English. And the reason why is because specifically diagnoses like schizophrenia or bipolar disorder, serious mental illness is usually not addressed in that community. And so these patients are actually second or third generation instead, that have gotten some Western influence to come in and get treatment. So my poster was literally this phenomenon. Another big one that's very interesting, and I use it all the time actually, is a lot of patients in the same community just culturally feel that an injection is more effective than an oral medication. And it's no big deal, but that does mean when I'm coming up and treating a patient, a lot of times they'll come to go, no, I want the shot. But, so many of my medications, a lot of times there's a negative connotation to the injections. But nowadays we have these great new modern medications that are good for 30 or even 30 days up to 6 months as long-acting injectable medications. So I definitely use that as a tool in my back pocket when I have somebody with a severe and persistent mental illness, because I can keep them from relapsing for at least 30 days, if not longer, because they prefer the shot. That's exactly what I'll do. And I'll explain to them, this is actually a really cool shot and it's good for 6 months.
That's great.
Thank you.
And then we also have, we have another one, and this is from Janice Solario. Are there similar services like Care Space in San Bernardino County?
Our superintendent, Dr. Gomez, a few months back did a call that was statewide about the different wellness centers that the county offices are doing. There was only 5 of us on that call, and all of the county offices, what they've been doing is creating wellness centers in their school districts. So as far as I know, we're the only model in the state that has them within our schools, but also across community locations. So we have 6 on our alternative education sites and 5 in community locations. And I'm not aware that San Bernardino County has something similar. Doesn't mean they don't, I'm just not aware of it.
Well, thank you. And we have another question from Allison. It's a question for all the panelists. How do you handle parents who are, shall we say, uncooperative, fear, denial, involved in the abuse or neglect, etc.? It must increase the level of difficulty in addressing the treatment for kids.
I can share my insight in that one. We do deal with that, and I think validating the parents' concerns is huge. Meeting them where they're at, letting them know that it's normal to feel that way. Also just building that level of trust with the parents. A lot of psychoeducation is important, but it can take a lot of time. It can take time to break down those barriers.
And I have to watch out that my approach doesn't segue into the being a little bit too blunt, because I've had my fill of helicopter parents, as most of us have had. One of the nice things about working on college campuses as opposed to high school campuses. But in all seriousness, I really like what Ms. Cloud just said about, look, here are issues that your student is having. We both want your student to do better, right? And we sell them like, okay, gaining buy-in to working on these things and addressing these issues, even when they're painful. Buy-in is a sense of, this is how we can come together to help your student, like what's in it for them. And that a lot of times that collaborative approach, I don't know if we call it collaboration or salesmanship, whatever, helping them to see the value in their participation of it. Sometimes you're going to have intransigent people that just, we all deal with those, but helping them to gain a sense of buy-in and a collaborative approach, that has worked for me with a lot of parents that were otherwise very difficult.
Very good. And then we have a comment from Victoria, and it says, we need to address self-care in our work environments through creating trauma-informed environments for all of our workers. And then I also have a comment question from Phoebe Matthew. Any tips on how to help students with emotional issues that have moved to multiple foster homes and multiple schools within the first 5 to 10 years of life? I have a few students in my school.
I would say kind of the theme that we really heard today was that trust in relationships. When you have kids that have been in and out of foster care, that many homes, that few years, they don't have any trust, they don't have any relationships. And so you have to work overtime to be that caring person for them. Unfortunately, most likely in those situations, they're going to continue moving to foster homes. So being able to be that positive person for the short amount of time that they're with you, I think is going to be really critical. Trying to work with the foster family, provide the foster family those supports and resources that they need. Maybe they can keep the kid longer, which would be a huge blessing for that child. But I mean, you've heard it all here today from all of the experts. It's the relationships and the trust.
And I would say also to help them gain a sense, no matter how young they are, that, you know, what can I do to help you learn to take care of yourself? What is available to you that you can, how can you learn to be good to yourself? Almost anybody can relate to that kind of thing. So that no matter what environment you may be in, how good or bad it might be, there are still things that you can do, and let's explore those things that you can do to take care of yourself and to be good to yourself in a, I wouldn't use the term holistic with someone younger, but in a holistic manner.
And then I just have two more comments. One is from Lily DeGesso, and I'm sorry if I said that incorrectly. Yes, I agree. Oftentimes in Hispanic culture is taboo discussing mental illness. Yeah. And then from Victoria, a comment, teach them self-value and self-care. Yeah, that's all I have in the chat.
If we don't help to give them at least some smattering of the sense of the fact that, as I mentioned earlier, that they are important, they matter, and they have infinite worth and value. When we encourage them to learn to take care of themselves, their response is going to be, why? I'm not worth taking care of. And I've heard that a lot. And so that's what all of us can do, is in some small way, give them the message that in truth, in fact, you matter.
Well, thank you so much. It's fantastic. I'm wondering if anyone else would like to ask a question. And as my colleague, Brian Berry, with the Ventura County, CEO of Ventura County Medical Society, who's on the call with us today, taught us a couple of weeks ago in our training that we had through the CMA. I would need to give you all 7 seconds to come through with a possible response, because it might take a moment to formulate this question. So I'm going to count to 7. Thanks, Brian. This is our chance. If anyone wants to raise his or her hand, we have the experts on the screen with us. Looks like maybe we've covered it all today. I'm sure we haven't covered it all, but for now. Dr. Lane, I see you on screen. Did you have a comment? No. Okay, just saying hi. All right, everyone, we want to thank you so much. That was absolutely outstanding. We appreciate all your work. Our kids and our families are in good hands with you all. Truly, thank you for all you do. And we will have another follow-up presentation on this, I'm sure, at some point. So we look forward to hearing more from you. As Danielle mentioned, we will send out slides and a recording from today's presentation that you can either listen to or share with colleagues who might have missed it. And go ahead and let us know if you have any other questions or ideas for our forums. And thanks for engaging with the IECHI. Everyone have a wonderful rest of your week and great to see you all. Thank you so much.
Thanks again to all. Take care.
Thank you. Bye-bye.